Dear chairs, dear audience, I would like to present my presentation. My main topic is systematic treatment of metastatic prostate cancer. Firstly, I would like to present my first project summarized 6 sentences. The metastatic castration-resistant prostate cancer. It is a late stage of the metastatic prostate cancer. The median survivor is 2 or 3 years. The enzalutamide and the abiraterone, it's a similar anti-androgen receptor signal inhibitors, but unfortunately we haven't got clinical trials which treatment is efficacy and safety. Our results, we showed that the enzalutamide is 23% better the overall survivor and 73% better the PSA 50 than abiraterone. But when we see the higher side effect, we showed that the abiraterone is better than the enzalutamide. Overall, we can ask that the enzalutamide is more effective than abiraterone, so it is prioritized the metastatic castration-resistant prostate cancer treatment, but it is very important that we have to minimize the side effect. We can know the abiraterone. Future result to aim to explain the mechanism based of the enzalutamide is higher efficacy, and has insurance system explain access to 2 drugs both. My name is Anikó Valikovics. I work as a doctor in Department of Urology in Semmelweis University. My vision: patient will have the best treatment option for metastatic prostate cancer. My mission: to find a drug that significantly improves the quality of life of patient. We have got 3 specific goals. The first specific goals focus the enzalutamide and abiraterone acetate in the metastatic castration-resistant prostate cancer. We started last year autumn. The second project focused the metastatic hormone-sensitive prostate cancer. We would like to see that which treatment with efficacy and safety: abiraterone, apalutamide, and enzalutamide. We started last month, and the third project, it is a PSMA radioligand therapy project. We started last year autumn. The first project investigating the efficacy and safety of abiraterone and enzalutamide in patients with metastatic castration-resistant prostate cancer. The epidemiology is very important because the prostate cancer is the second most commonly diagnosed cancer in the world. More than 1.2 million new cancer cases in the world, and the mortality is higher than 300,000 patients in a year in the world. The metastatic prostate cancer, it is a late stage, and the median overall survivor of 30 or 35 months. The abiraterone and the enzalutamide, it is an anti-androgen receptor signal inhibitors, but not clinical trials are available for the direct comparison of their efficacy. The aim to investigate which of these 2 treatments is more effective in metastatic castration-resistant prostate cancer. The clinical question: which treatment is more effective, abiraterone or enzalutamide for mCRPC? When we send the PICO, the population is the mCRPC patient, the intervention is the enzalutamide, the comparison is the abiraterone, and the primary outcome is the overall survivor, and the secondary outcome is the PFS, the PSA 50, and side effects. The hypothesis: enzalutamide is superior to abiraterone in patients with mCRPC. The clinical implication: increased therapy efficacy in mCRPC patient. We have got only one domain when we see the search key. We use 3 databases, and we have got more than 9,400 results. After, when we finished the article selection, we can use 46 full text in this project. Now I would like to present 2 results, which is the 2 main important results this project. The first is the overall survivor. The overall survivor means when we start the therapy, and when we finish the therapy, it's the time. We see here the first and the second line treatment. The population is the metastatic castration-resistant population who use the enzalutamide or apalutamide. We have got 2 arms. The enzalutamide arm, we have got more than 20,000 patients. The abiraterone arm, we have got more than 29,000 patients. The hazard ratio is 0.77. It means that the enzalutamide is 23% better than the abiraterone. The heterogeneity is high because it is a 89 cents, but it is a mathematical significant results and clinical relevant results. When we see the PSA 50, when the PSA decreased more than 50 cents under 3 months therapy, here we see the first and the second line treatment. We have got enzalutamide when we have got more than 4,000 patients, and abiraterone we have got more than 5,000 patients. When we see the odds ratio, it is 1.73. It means that the enzalutamide is 73 effective than the abiraterone. The heterogeneity is high, and it is mathematical significant results and clinical relevant results. Now we check the manuscript. This project, there are some strengths and limitations. The strength is it is a large, simple size project, 9 outcome measures, significant results, but the limitation, observation studies included, and there are some outcomes when then we have got limited data for same. Conclusion, the overall survival and the PSA 50 rate are significantly better for enzalutamide. The overall adverse events are less frequent for ABI. Cardiovascular side effects are more favorable for ENZA, while the neurological adverse events are less frequent for ABI. The implication for practice, ENZA showed superior efficacy, ABI show more favorable side effects profile. The implication for research to assess and understand the mechanistic background of the superior effect of ENZA. We would like to publish this project, the prostate cancer and prostate diagnosed. The second project to investigate the efficacy and safety of abiraterone, apalutamide, and enzalutamide in patients with metastatic hormone-sensitive prostate cancer. The hormone-sensitive prostate cancer, the addition of an IRSA to ADT has become the standard of treatment care. Currently available IRSA treatment options include enzalutamide or apalutamide and abiraterone. No clinical trials are available for the direct comparison of their efficacy. 20% of patients with localized disease progress to metastatic prostate cancer within 5 years. 608 of patients are directly diagnosed with de novo metastatic hormone-sensitive prostate cancer in the USA. The aim to investigate which of these 3 treatments is more effective in metastatic hormone-sensitive prostate cancer. The clinical question, which treatment is more effective, abiraterone, apalutamide, or enzalutamide for MHSPC. When we send the PICO, the population is the MHSPC patient, the intervention is the apalutamide, the comparison is the enzalutamide, abiraterone, the primary outcome is the overall survival, the secondary outcome is the PSA 90, time to castration-resistant prostate cancer, the PSA level it's 0.2 nanogram per milliliter, and side effect. The hypothesis is apalutamide is superior to abiraterone or enzalutamide in patients with MHSPC. The clinical implication, increased therapy efficacy in MHSPC patient. We have got only one domain. We use 3 databases, and we have got more than 10,000 results. The third project is identifying patients with metastatic prostate cancer who benefit from PSMA radioligand therapy. The PSMA radioligand therapy, it is a new treatment option in metastatic prostate cancer. The prostate-specific membrane antigen, it is a transmembrane glycoprotein which is overexpressing in high-grade advanced prostate cancer. The clinical parameters for PSMA radioligand-sensitive patients need to be identified. The aim to identify the clinical and pathological parameters defining the most responsive patient to PSMA radioligand therapy. The clinical question, who the different clinical parameters influence the outcomes of PSMA radioligand therapy in metastatic castration-resistant prostate cancer. The PICO, the population is the PSMA radioligand therapy patient, the comparison is the ECOG age metastatic localization, the primary outcome is the overall survivor, the secondary outcome is the PFS, the PSA 50, and side effect. The hypothesis, the PSMA radioligand provides greater overall survivor in advanced metastatic castration-resistant prostate cancer patient with specific clinicopathological characteristics. The clinical implication, PSMA radioligand therapy may be more widely used in advanced metastatic castration-resistant prostate cancer. We have got only one domain, we see 3 databases. Here we summarize these three projects. And the end, Heinlein asks that everything is theoretically impossible until it is done. Thank you for your attention.
May I have one question regarding your first project? So actually in Hungary, which product is more often used?
Thank you very much this question. We use abiraterone because the abiraterone, it's an older drug than the enzalutamide, and it's cheaper than the enzalutamide because there are some genericum, these drugs.
So thank you for your presentation. My question is about your second topic. From your current knowledge, because I know it's not so, project is not so deeply done, which of the three treatments do you think is the most effective for treating the metastatic hormone-sensitive prostate cancer?
When we see the apalutamide will be the more effective than three treatments. And enzalutamide and abiraterone, it's very similar, effective.
Thank you so much.
Congrats to your presentation. I have a question for the forest plots. Both of them there were little text that first and second line treatment. So yes. Does that mean that either first or second line these drugs were used, or I'm not completely understand?
Yes, we see the first and the second line treatment, and we show it that the first line and the second line treatment, it's similar statistical significant results, these two drugs. So it is a summarized forest plot, but we see different.
Okay, nice, clear, thank you.
Thank you.